My name is Donna Peace, Executive Director of the American Lung Association in Colorado. Our mission is to save lives by improving lung health and preventing lung disease. Lung disease is a challenge that impacts all of us. Whether it's the growing rates of asthma in children, the impact of chronic obstructive pulmonary disease, or the escalating threats to our air quality from coal-fired power plants or frequent wildfires in our state. These are critical and urgent issues that affect our friends, families, and local community. Every day, we focus on preventing and treating lung disease, protecting our air, reducing tobacco use, and supporting those living with lung disease and their caregivers, and funding research that improves lung health for all. For 120 years, Coloradans have trusted the American Lung Association to protect their lungs. Lung diseases, including COPD, remain the leading cause of deaths in the United States, and lung cancer is the leading cause of cancer-related deaths. Research shows that 1 in 18 people will develop lung cancer in their lifetime. In Colorado, radon gas in homes is the second leading cause of lung cancer. High levels of cancer-causing radon gas have been detected in more than 46% of Colorado homes.
So Emily's symptoms started fairly subtly, and she's a very healthy person, but all of a sudden she started to have kind of a weird cough. So Emily's diagnosis came after she had gone to her primary care doctor and they took an x-ray of her chest. It turned out that she had something in her lung. And of course I got the phone call that it was cancer. There were some tears. There certainly were some moments where we just were silent and didn't know what to do. So we made the decision not to tell our kids. They were very young. I can tell you that attempting to keep things normal as a family is a complete joke. Why are you going to this appointment? Why are you going to this appointment? Why are you sad? Why are you upset? I mean, the kids would ask us those questions. I think the kids knew deep down, especially as things progressed and Emily got much, much sicker, where things were going to end. So Emily became very excited and interested in the American Lung Association. She found an event with the American Lung Association, the Run the Rocks event, which is held every October at the Red Rocks Amphitheater, and she decided to get involved there. And so in her mind, she thought if she could help raise awareness, but also raise money, that she could come up or find a way that other people would maybe not have to deal with the same thing that she was dealing with. The impact that we were having in a family could be avoided one way or another. So I continued to work with the American Lung Association to honor Emily. She cared about the organization, so I care. And I want to help others avoid what my family has had to go through.
If lung cancer is detected early, before it spreads, the chances of surviving for 5 years or more increases by 64%. Thanks to ongoing research and resources, the lung cancer survival rate has risen by 44% in just the last decade. Lung cancer is just one example, and there are many more diseases and respiratory challenges than you might imagine, and they can impact anyone.
I was really lung healthy, avid cyclist, very active, really at the top of my game. When Saved by the Scan started, I was in a study with National Jewish, and they called me afterwards, and they said, "We have good news and..." Sorry. The good news is, you don't have lung cancer. And the bad news is, you have COPD. The challenges I've had since I was diagnosed with COPD are that my lungs aren't as strong as they used to be, and I developed multiple large pulmonary emboli in both lungs, actually pressing on my heart. So now I'm on 24/7 oxygen. After my COPD diagnosis, I joined the American Lung Association board because it's near and dear to my heart. The Lung Association advocates for people with lung challenges, all kinds of lung challenges in our community. I was in the fight for air climb. I was a top fundraiser for many years. If I could tell people anything about lung health, and I'm telling you, don't even start. Don't pick up a vape. Don't pick up a cigarette. Don't be in the room with somebody who's smoking. I was really happy after I joined the board to see that the American Lung Association is really part of a community. They bring people together. We have a resource. People like me have a resource, and they provide it. We couldn't do our research and our funding without our donors, our volunteers. What I'm trying to say is, if you can't breathe, nothing matters.
Doctors care for patients every day who are impacted by lung disease, from an infant struggling to breathe in the NICU to a child who can't control their asthma. The knowledge that doctors rely on to treat patients is in part thanks to the research provided by the American Lung Association. Doctors are able to save lives because of the dedication of our volunteers, staff, and donors who make vital advocacy and groundbreaking research possible. Your support genuinely saves lives. Thank you for being the difference in someone's life.